The following portion of Daytime is sponsored by Orthopaedic Medical Group of Tampa Bay.
If you have significant pain or if you've suffered damage to your knee or hip joints, your doctor may recommend surgery to address the issue. Here to tell us about modern approaches to hip and knee replacement is Dr. William Trey Shield with Orthopaedic Medical Group of Tampa Bay. Dr. Shield, good to have you here.
Thanks. Pleasure to be here.
So what are some of the signs that a total hip or knee replacement is needed?
Well, some of the signs and symptoms of hip or knee arthritis are, it's mostly revolves around pain. So hip pain typically manifests itself as severe groin pain, pain on the outside of the hip. A lot of times patients will come in and complain of really entire leg pain, so the pain that radiates down, sort of deep in their thigh, down to their inside part of their knee.
So if somebody is in severe pain, surgery is probably where they'll wind up, right?
Well, typically yes. The only person that tells us when you're ready for a hip or knee replacement is the patient. And so it's really all about understanding how this affects their lifestyle. Typically they'll say they can't get out of bed, they're having trouble walking, activities of daily living, putting on shoes and socks becomes very difficult. So it can be a really debilitating disease.
What do you say to patients who may be concerned about the recovery time or the discharge? How intensive is that?
Well, everyone is different, obviously. There are some patients who can't walk, might be wheelchair bound or wheelchair dependent, secondary to end stage hip or knee arthritis. There are some people that are still getting by. They're still able to work. They're still able to perform activities that they might otherwise enjoy. So really kind of a wide range, but ultimately most of the time you're not that much worse off than you were before the surgery.
Except you don't have the pain.
You're gonna well, there's some pain to be expected, but you don't have that sort of that bone-on-bone pain that most patients describe. There is a pain associated with this, with the surgery itself, but getting around, a lot of times people are so debilitated before that it's just kind of not as severe as it was before.
So what is your approach to hip surgery specifically? We've talked with a colleague of yours about knee replacements, but how does the hip replacement work?
Well, hip replacement can be done a variety of ways. There's several different approaches that can be done. Each approach also can be done in a different way. Typically, the way that I approach it is either with an anterior or a posterior based approach. This is a hotly debated topic in orthopedics at this point, but really what I tell people is you're going to have a good outcome no matter what approach is used. With the anterior approach, it is typically a muscle sparing approach where we go in between two muscles. There is some tissue that has to be released to do the procedure. Patients are, regardless of what approach we use, we get the patients up right away, get you walking, and get you moving right away.
But they have options, right, is what you're saying. And will the patient be involved in the decision as to what approach you use?
We always involve the patient in the decision about whatever procedure we do, and then we tailor whatever approach we use to that specific patient.
Thank you so much, Doctor, for explaining all of that and for joining us today.
Absolutely. Thank you.
You're welcome. And if you'd like to learn more about Orthopaedic Medical Group of Tampa Bay, just visit omgtb.com. Daytime, we'll be right back.
The preceding portion of Daytime was sponsored by Orthopaedic Medical Group of Tampa Bay.